Welcome to the Wise Path. Today, we're tackling a sensitive but important question. What happens when masturbation becomes a daily habit? In particular, we're looking at insights from a female doctor who sheds light on the physical, emotional, and social dimensions of frequent self-pleasure. Our goal is not to pass judgment, but to provide clarity, so you can cultivate a healthy and balanced outlook on your sexual well-being. Understanding the fundamentals is crucial. For many people, masturbation serves as a form of self-discovery, a means of tension release, and a gateway to learning about their own desires and boundaries. Though it can be a healthy habit, the key lies in frequency and context. When it shifts into a daily or more frequent routine, it's natural to wonder whether there might be unintended physical or psychological consequences. While many individuals find that self-stimulation elevates their mood and promotes relaxation, others worry about issues such as fatigue, desensitization, or excessive reliance on the dopamine rush that follows orgasm. On a physical level, masturbation rarely poses significant risks. Unlike partnered intercourse, it doesn't involve sexually transmitted infections, and the resulting boost in blood flow can support sexual function and pelvic health. It also releases hormones like endorphins, which can improve sleep quality and help manage stress. However, overindulgence may sometimes lead to soreness if there is inadequate lubrication, skin irritation caused by repeated friction, or a temporary drop in sensitivity that makes other forms of intimacy less pleasurable. While these side effects may be uncomfortable, they are generally short-lived and tend to resolve when one scales back the frequency of self-stimulation. When we move to the psychological realm, the picture grows more nuanced. For some, daily masturbation can be an effective way to unwind and cope with anxiety or tension. Yet, if it becomes the primary outlet for handling life's challenges, it may morph into a dependency that crowds out alternative, healthier coping mechanisms. Cultural and personal attitudes toward sexuality often shape one's feelings about masturbation, which can result in shame or guilt if there is a stigma attached. Alongside this, many female doctors warn about the dangers of excessive pornography use accompanying frequent masturbation. Consuming too much sexually explicit content can set unrealistic expectations around intimacy or body image, and it may erode one's ability to form satisfying, real-world connections. Social and relational consequences do not always appear directly, but daily masturbation can sometimes signal deeper issues. If someone habitually isolates themselves, avoiding social opportunities or emotional intimacy, it could foster disconnection and loneliness. In romantic partnerships, choosing self-stimulation over shared intimacy may drive a wedge between partners, potentially sparking resentment or distancing. Discussing sexual desires, preferences, and concerns is vital, but embarrassment can lead to silence. In some instances, reaching out to a trained professional, like a therapist, counselor, or sex educator, can pave the way for better communication and healthier patterns. Moreover, repeated self-pleasure raises the question of whether it might be edging toward addiction. While having a robust sex drive is not inherently problematic, compulsive behavior that continues despite negative outcomes can be harmful. According to many doctors and sex therapists, genuine sexual addiction involves a persistent inability to regulate urges and a readiness to ignore significant personal costs, such as missed deadlines at work or diminishing quality in relationships. Recognizing this pattern is the first step to seeking professional help, which can include counseling or behavioral strategies aimed at breaking the cycle of compulsion. Determining when masturbation has become problematic often involves looking at key indicators. If daily responsibilities start slipping, or if social gatherings and friendships are routinely bypassed to accommodate the habit, that suggests a need to reassess priorities. Persistent guilt, shame, or distress after masturbating can also be a red flag, as is feeling unable to reduce the frequency despite wanting to do so. Consulting a doctor or therapist is not a sign of defeat, but rather an empowering decision that can offer solutions for managing these concerns. Cognitive behavioral therapy, mindfulness techniques, and open dialogue often help individuals find healthier, more balanced ways to approach self-stimulation. Female doctors commonly emphasize that masturbation, in and of itself, is rarely the cause of serious health issues. More often, negative outcomes arise when excessive frequency is paired with harmful practices or beliefs. For example, pairing masturbation with heavy porn consumption may distort one's expectations about sexual activity, leading to dissatisfaction or disconnectedness in real-world encounters. Similarly, persistent guilt rooted in cultural or personal taboos can create an unhealthy emotional environment that overshadows any potential benefits of self-exploration. However, for the majority of individuals who experiment with daily masturbation, these issues may be transient, especially if they recognize the importance of moderation. Striving for balance is the overarching theme. Masturbation can be part of a fulfilling and self-aware lifestyle, provided it doesn't eclipse daily obligations, meaningful relationships, or emotional well-being. If you notice irritations, dips in energy, or disruptions in your social life, it might be worthwhile to consider spacing out sessions, seeking new hobbies, or talking to a healthcare professional for advice. By redirecting energy into friendships, creative endeavors, or physical exercise, you can reduce the risk of turning masturbation into an all-consuming routine. In conclusion, masturbation is a common and generally healthy aspect of human sexuality, capable of benefiting both body and mind. However, when it shifts into a daily habit that causes discomfort, isolation, or a sense of loss of control, it may be time to pause and reflect. Examining the potential causes, whether they stem from stress management struggles or unrealistic sexual expectations, can shed light on how to restore balance. There is no shame in seeking expert input or in opening up to trusted friends or partners about these concerns. Doing so can help ensure that masturbation remains a positive, rather than problematic element of one's life. Thank you for joining us on the Wise Path for this informative discussion. If you found these perspectives useful, please remember to like, comment, or subscribe. In our upcoming videos, we'll continue addressing topics that empower you to make confident, informed decisions about your well-being and relationships. We look forward to seeing you next time.